Welcome, everyone, to today's webinar, Managing and Measuring the Patient Financial Experience. I am Laura Dierda with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenter, Jan Oldenburg. Jan Oldenburg is the Consumer Health Information Strategist and Patient Engagement Specialist at her consulting firm, Participatory Health Consulting. Through her organization, she helps organizations create and implement strategies related to digital health technology and personal health engagement. Jan has held roles within EY's advisory practice as the Vice President of Patient and Provider Engagement in Accountable Care Solutions at Aetna, as a senior leader in Kaiser Permanente's Digital Strategy Group, as well as founding roles in several consulting companies focusing on strategies for using digital technologies effectively in healthcare. I'd also like to thank our sponsor, CareCredit. CareCredit is a health, wellness, and personal care credit card dedicated to helping people get the care they want and need. For more than 30 years, CareCredit, a Synchrony solution, has helped millions of people by offering special financing options with convenient monthly payments. CareCredit has 11 million cardholder accounts and more than $35 billion of credit is available to cardholders. Accepted at more than 210,000 locations, CareCredit helps patients pay for a wide variety of health and wellness procedures, treatments, products, and services. At this time, I am pleased to turn the floor over to Jan to begin today's webinar.
Good afternoon. I'm very happy to be here, and thank you, Laura. You know, several weeks ago, I was speaking with a chief experience officer from a very well-known children's hospital. And I asked her if she measured the satisfaction with their financial experience. She said no. And then there was a long pause, and she said, but you know, I'm also responsible for complaints and grievances. And a full 75% of the complaints and grievances we get are about the financial experience. I guess maybe I should be measuring that. And that's the topic of today's webinar. We'll really be talking about 4 areas. First, some of the impacts of healthcare consumerism and how it's changing the game. Then, why the patient financial experience matters. And we'll talk a little bit about how to define and measure what's going on in your financial experience and how to upgrade, change, and measure the outcomes. And then we'll finish off by talking about healthcare financing before we move into the Q&A. So we'll start by talking about the impacts of healthcare consumerism. And you know, for consumers, everything is changing. A lot of policy decisions, both at the federal and state level, and also within companies and organizations, have really changed the game about healthcare, insurance coverage, and employment. And people's expectations and understanding of what it means to have coverage have changed. Digital has also impacted pretty much every area of patients' lives. And with that, their thinking and their framework about what it's possible to do online. And that impacts healthcare, as we'll talk about. And then, of course, consumers are bearing a higher share of the cost. And all of those things together make for a situation where it's no wonder that the way people think about their healthcare decisions have changed. In particular, I want to focus for a moment on the digital experience. So if you think about the way people live their lives today, everything from their banking to their social media to their entertainment options has shifted in some manner or another as a result of digital. When people find out what work I do, I can't tell you how often they say something to me like, If I can make my dog's veterinary appointments online, why can't I make my own with my providers? Or if I can see all my finances in one place, why can't I do that with my health record? So we see that transfer of expectations from other areas of their lives into healthcare. They want the same digital experiences, the same convenience, and they wonder, why hasn't healthcare kept up? Why can't I do the same things in my healthcare experience that I'm used to doing in other areas of my life? People are voting with their feet, looking for providers who offer that same level of digital convenience that they're used to and already experiencing in the rest of their lives. They want healthcare that's convenient, easy to access, personalized, and transparent. And as a result, they're getting more engaged in their healthcare. They have to be, because far more choices are up to them than they've been in the past. Long gone are the days of the Marcus Welby or family doctor that you can rely on to know everything about your health and really make a lot of your decisions for you. People have options, and they want to understand both what those options are and how cost affects them. Alexandra Drain, who started Emmy, once called the conversation about cost in healthcare one of the great unmentionables, by which she meant it's present in almost every healthcare transaction. It's in the exam room. It's in the hospital bed, but it's rarely on the surface. It's rarely talked about. Providers don't feel a need to talk about the financial conversation, and most patients are a little too embarrassed to discuss it. But all of those things have an impact on how they approach and think about healthcare. And in particular, this happens because the patient's share of cost has increased dramatically over the last 15 years. You can see it on this graph, but it's also there in some other statistics, like the fact that 85% of healthcare consumers currently have a deductible. In 2017, a Kaiser Health tracking poll found that a full 45% of Americans said that if they got an unexpected health bill of even $500, that medical expense would be very hard for them to cover in the ordinary course of their lives. You can see that burden on consumers from the hockey stick line at the top on just spending on deductibles. At the same time, this is affecting the provider side as well, because the revenue share from patients increased 88% just between 2012 and 2017. So that changes how healthcare providers have to think about estimating, billing, collections, and all of those other factors that are in the mix when you're talking about consumers. And a lot of those policies that really drive those higher costs are based on the assumption that if people have skin in the game financially, they'll get more engaged in and make smarter decisions about what care they really need and what they pay for it. But in fact, it hasn't always worked out that way because people don't really have a good sense of what things are really optional and deferrable and what things aren't. So a full 40% of consumers have reported that they have declined treatment due to the cost of it. And 29%, almost 30% of consumers have said, I don't take my medication as planned because of cost. Another 24% said it's really hard to cover the cost of their prescriptions. We're seeing that on a daily basis as we watch the news about diabetics who are in the hospital or even dying because they're skimping on their insulin because it's no longer affordable. A full 50% of patients said that the cost impacts significantly which providers they choose. Some of this is the policies around more share of cost being borne by consumers, But the other part of it is that we haven't done a particularly good job of helping people understand the equation and the parallel between cost and quality. In every other area of their lives, the higher the cost, the better the quality. If I spend to buy a Coach purse, I expect the quality associated with the Coach purse. That's not always the case in healthcare, and people don't know how to tell when it's a required cost that will buy quality and when it's not. So as we are thinking about all of those factors, it starts to raise the importance of the patient financial experience. And in that experience, it really matters that we're looking at it appropriately and measuring the right things. So people generally experience the financial part of healthcare as a part of the care experience. And why wouldn't they? If you think about going out for a great dinner, paying for it at the end is simply a part of the process. It's not some extra thing that happens 4 weeks to 4 months later after you've forgotten what dinner tasted like. It's right there as a part of the experience. Patients feel the same way about it, even though it's often delayed in time. And this is particularly important for ASCs, not just because surgeries are often associated with high costs and the billing process that takes place over months, but it's also that their recovery is often lengthy. They have a risk of surprise bills from out-of-network participants during the process. And perhaps most importantly to this dynamic, they probably don't have a long-term relationship with the ASC. So you have to work harder to make it a great experience. Another evidence that the patients consider the financial experience an integral part of their care is that 70% of the patients in this particular study who rated their care quality the highest over the last 2 years also rated their billing and payment experience highly. And the corollary was also true. If they rated their billing experience poorly, they were significantly less likely to give the rest of their care experience high marks. There's a correlation in people's heads. We also know that full 70% of consumers are confused by their medical bills. And a recent Becker cited a study by Eight Group that said that 88% of patients want more straightforward bills. In that situation, you can't afford to be ignoring what that process is bringing for people. So as we think about the patient financial journey, it's really got 4 options, and they run parallel to and somewhat intertwined with the experiences that people have in the rest of their journey. So it starts with researching options, then initial contact and the pre-appointment process, then your appointment and financial discussion, and finally, we hope, paying your balance due. So we'll be talking about each of those stages of the process as we move through the rest of this conversation. Because at the heart of this is, how do you really think about defining, communicating, and measuring that experience that patients are having with the financial part of the process? In each case, as we talk about that financial experience, we'll talk about it in key areas. We're assuming you're doing some assessment of your current state, and part of that is about defining what you already know. What stats are at your fingertips? What would be helpful? What gives you clues about the experience people are currently having? Then we'll talk about how you adjust and communicate the changes that you're making to that experience and what matters to pay attention to as you're attempting to impact it. And finally, we'll look at then how you measure whether the changes you've made have had impact, and how you continuously improve that process. So we're going to start with that upfront process of researching options. In some ways, this is the trickiest part of the process for you to understand and to measure, because it's very hard to tell who's had an experience with your website and never called for an appointment, never tried to get in, never initiated contact with you. But there are some clues in the process. First of all, you can look at how many people are looking at your website, and in particular, looking at the financial pages that you've got up. You can look at how many calls are being abandoned, and how much people are saying about your site, your environment in social media. So if you're not already tracking social media sentiment, I strongly advise you to do so. It can be invaluable in getting a read on what's going on. And part of that tracking is also setting up social care programs. So if someone is tweeting or putting on Facebook something about a negative experience that they're in the middle of, you can intervene and intervene quickly to address that experience and to help them. When you think about what kinds of changes you should be making in this process, one key area is to really provide financial transparency online, cost transparency. And that is a lot different. Doing that well is a lot different than just posting your charge master online. So it might involve posting something about the average cost for various common surgeries. It might involve talking about what some of the things that can affect the cost of a treatment are, or a procedure. It's also really good to make it clear up front that there are financing opportunities available and how they go about exploring them. And then making sure that you're being really clear about what insurance you accept and what the impact will be based on who you're in network with and who you're not in network with. So once you have thought about all of those things and updated your website, I actually suggest looking at it yourself with a skeptical eye, starting as if you are a naive consumer, or better yet, ask your family and friends to act as secret shoppers and test out how much information they can find on your site as if they were going to have a procedure and what their reaction is to the way you've presented it. There's nothing like a naive user to tell you a lot about where you're making assumptions that are invalid based on people's actual experience. And then, of course, once you've made the changes, you've communicated them clearly on your website, in your materials, to the patients you're talking to on the phone, and to your staff, then you can start to think about measuring the impact. And that includes looking at those same measures that we started with in terms of what data you have and checking to see whether it is different or improved. One of the areas we strongly encourage that you look at is whether you're resolving calls or problems in one call, or whether it requires the patient or you to call back more than once. Hopefully you're having increased conversations at early stages about the cost, and people are using your financial tools because they find them usable and informative. And you'll see an uptick in returned patients as a result. These things really do matter to the experience, because the more that you are making it easy for people to connect with you, the more that you are setting the tone in your upfront information, the more that you are building trust. And it starts very early. People form impressions about whether they trust you or not within minutes of the first experience. And that's as true of organizations as it's true of individuals. You've already formed opinions about me based on probably that first story I told. So you become trustworthy by acting in transparent and trustworthy ways. And that's your goal with this process. You want to be reliable, transparent, and trustworthy, not to mention convenient. So let's move on to that second phase. This is the initial contact, what happens during the pre-appointment part of it. This is when the person is requesting an appointment or scheduling one. It's when they might ask for pricing, insurance information. And again, you want to start looking at what's your rate of canceled appointments? How long do people have to wait before they can get an appointment, before you can confirm a date? And how much of that time are you aware of, and how much of it starts at the provider they're seeing and you are only in on the tail end of it? So think about, when you think about your options, your penumbra, so to speak, the amount that you can potentially influence extends into the offices of the providers who are bringing patients to you. And you want to think about whether you can streamline any of those things. And then what kinds of things are people initially asking, and what do they want to know? This is the moment to start the financial conversation. My husband has been lucky enough to have 2 outpatient surgeries so far this year with 2 different organizations in our community. And I can tell you that except for verifying that he had insurance and getting the authorization from insurance, nobody talked to him or to me about the financial experience of it. Nobody asked whether we were going to have any difficulties covering the deductible or the copayment. Another person I interviewed recently talked about just trying to find out the cost of an ultrasound. He had a high deductible plan, $6,000 deductible, so a lot of it was on his dime. And he had to make 15 phone calls just to find out cost and to figure out what was the lowest cost provider. His doctor didn't know. Nobody, in fact, at his provider knew how their costs compared. And when he finally did find someone who agreed to do it for a lower price, when he got the bill, it wasn't for the price they'd agreed on. And he had to make another 3 phone calls in order to get that straight. Now, if that's happening in your environment, that is not a satisfactory experience. And you really want to think through what that takes for somebody to get an estimate from you or from your site. A TransUnion study from 2017 found out that a full 75% of patients said that getting a cost estimate up front would positively impact their view of that provider. And 57% said they'd be more likely to return to a provider that gave them a cost estimate up front. So think about that impact that a simple cost estimate can have. And it can start as early as the point when they're making contact to make an appointment. It may not be a finished conversation at that point, but it can start there. This is also the point to start thinking about discussing financing options if there's any concerns, and also considering whether they want to talk to a financial counselor even that early in the process. And those things, making sure that you're providing them, does take some redesign of your workflow. You have to think about where that financial conversation might take place. You need to think about who has the appropriate information to provide cost estimates and what it's going to take for you to provide them. The same TransUnion study found that 75% of providers actually could provide cost estimates today, but only 12% of them actually were providing cost estimates. So that's a big gap and an opportunity. And then, of course, after you've made some of those changes, there's again the opportunity to say, well, did what we are doing make a difference? How are we doing in terms of the referral source? Has it changed? Are we getting more recommendations from family and friends? Is the social media trend and sentiment positive about us? Are appointments being secured, and what's our rate of filling up our schedule in advance? And how are we doing on cancellation? Because, of course, you can do a lot of things right, but if your cancellation rates are still really high, you're going to be scrambling to cover your costs and fill your docket. So these things really do matter as you're thinking about the patient's view of this experience. And because they're paying more out of pocket, you can't assume that their insurance will cover it. You have to assume that they may be covering a significant part of it. That person I told you about earlier who had to make the 15 calls kept encountering people along the way who said, but don't worry about it, your insurance will cover this. And he had to keep saying, actually, my insurance won't. I have a deductible. I'm responsible for those first dollar costs. That hasn't really been ingrained in the way we think and talk yet, and it's really important to be doing that appropriately. Again, anticipating patients' needs for that information is one way that you appropriately build trust in who you are and your ability to take care of them. So now let's think about at the actual appointment or procedure and what the steps are going on there. So at this stage, you've probably got the most metrics that you have in any stage because you can start really looking at how many people are paying at the point of care, very concrete. You can look at how many people have enrolled up front or enrolled shortly after the procedure in your self-service payment option. Assuming you have them, and if you don't, let's talk about that in the improvement section. But the other part is this is the moment to look at what the rates are of people, in fact, beginning to use the financing and enrolling in the financing choices. It's also the point to look at the payment options people are using and think about what that tells you about your audience and the need for various kinds of processes. And of course, at every point in the payment cycle, complaints and grievances really matter. And they matter both for tracking how well you're doing, but as I said earlier, this is a place that you can recover service. And so if someone's in the middle of something and having a bad experience, you can actually intervene if you're paying attention to those social media metrics. Now, in the process of, in this point in the process, it's one of the places where care and financing intertwine most closely. So I often recommend that people actually train their doctors on how to talk about the cost of options, not just the efficiency or effectiveness of them. And this is based on an experience I had when I was with Kaiser Permanente. And I was responsible for developing and implementing Kaiser's first cost estimation tool based on a law that went into effect in Oregon. And during the development process, which it was difficult to figure out what things cost us, but during that process, leadership was really clear that this was something we were providing for patients and caregivers. It wasn't something we were going to bother the docs with. We never needed to make the docs aware of this. They didn't want to know. And actually, leadership kind of was thinking, and it'll take time away from care. We don't want them to have this. But within 3 weeks of the time that we implemented the solution, we had doctors inundating leadership and my team with calls saying, you have to give me access to the same tool that you're giving my patients. Because they're walking in here and they've got sheets with costs on them about various options for how we go about treating. And they want to know, when you take cost into account, which treatment approaches are the most appropriate. And I can't answer their questions. You're making me look stupid in front of my patients. Help me to be the resource that they want me to be in terms of discussing both the cost of these procedures and their efficacy so they can make reasonable decisions. And that's a key reason. To the degree that you can influence those doctors and have a session or more than one session, or provide them with tools so that they can incorporate the cost into their discussion of treatment options, everybody in the mix is going to be happier and more effective. Then there's also the process of thinking about where you incorporate a discussion with the financial counselor in the workflow of your process. Now, it may seem very awkward on the morning of a surgery, for example. So it might be something that you really want to take care of in a phone call beforehand. But you need to think about where that discussion is going to happen, how you invite it to happen, and how you change workflow so that it's effective for you to present that. This is also the moment after a final treatment approach has been selected, where you may want and need to re-estimate the cost of the procedure. This is the place, too, to discuss financing options so the patient is aware that that is potential, or their caregiver or their financial, the person who's responsible for their finances. But this is the point in time where you want to make sure that they've got every option available and to know what it is. And you can even assist them with the financial application process in that, at that point, if you've planned for it and built it into workflow and timing. And then, of course, once you've made those kinds of changes, communicated them to everyone who's involved, including staff, including patients, including doctors, then it's time to start looking at whether those changes have had an impact. So have you gotten an increase in payments up front, payments in full? Has there been a change in the usage of the healthcare financing option? Are you seeing a difference in the tenor of the complaints and grievances you see on the site? Because those are the kinds of things that making these changes should start to impact. And again, productive financial conversation can really tell the patient that you understand their situation, you understand their needs, and you reassure them. It builds trust when they see that you really understand their situation and that you're aware of the things that they're concerned and worried about. And now we're down to that last stage of the process, paying the balance due. Again, this is a place we probably focus today an inordinate amount of our energy and time. And you have a lot of data to tell you what's going on. You know how many days you have accounts in credit balance. You can probably tell what your open rates are for financial statements and for prepayment reminders. And honestly, if you've done those things upstream about coaching people about their finances, teaching them what to expect, helping build and change their expectations about what the outcomes of this are. Just that alone should see a change in how often people open their bills and how rapidly they open their bills. But you also know something about how many bills are being sent to collections, how many bills are paid in full, and what your net promoter scores are. There's a 10% drop in satisfaction between the time somebody leaves care and the time that they pay their bill. And that is pretty much attributable to the financial process. So if you're thinking about satisfaction scores and you're worried about them or trying to improve them, you can't afford that 10% drop. And this is one of the key areas that you can reinforce the things that you're trying to change and make those changes. So as you're thinking about the things to look at, the things to change in this process, one of the big ones is implement a survey process. It's the heart of what we're talking about. But usually you're probably doing a lot of surveys about the care, but you're probably not asking people about the financial experience. And it should start not just about how they feel about their bill, but up front. How did registration go? How did cost estimation go? Did they get financial counseling? Are they aware of financing options? How was the billing process? Did they understand their bills? And there are a couple of points that it makes sense to offer those surveys. Shortly after you send out a bill to a person, shortly after they make a phone call inquiring about that bill, shortly after they actually pay, because you want to understand more in the moment what's going on in their hearts and minds during that billing process. This is also a point to look at redesigning your statements. Are they clear? Remember, a full 88% of Americans said they wanted clearer bills. That should be something that you can provide to them, and I strongly encourage you, when you're going through a redesign process, bring patients into the process to work with you on your redesign, to evaluate with a critical eye. And if it's not a place that you already haunt, I also suggest that you keep an eye on there's a cost of payment website that was started by the New York Times, and I believe is now continued by Kaiser Health News. And just I also suggest you start to measure the correlation between payment rates and your patient satisfaction, because other people have found they're correlated. If you're seeing relationships, it gives you more power to make these changes in your organization and talk about the reasons that they're really needed. And of course, as you are measuring the impact of these experiences, you want to look at the things about how many times do you have to rebill people? Is that being reduced? Are you getting fewer calls asking questions about how to read their bill? Are your patient satisfaction rates moving upward? And if they're not, let's really relook at these processes. You should be seeing fewer payment-related complaints and grievances and an uptick in your social media sentiment, as well as, of course, the increase in net promoter scores and balances paid in full. This is a place where you can do well by doing good for patients. And I also really strongly suggest this is not a kind of one-time effort where you've made changes and then you rest on your laurels. This is something that you want to continuously look at, because there's always an opportunity to get better, and you want to keep improving. You also want to keep apprised of what your competitors are doing in this space because that too tells you about improvements and enhancements that you may want to consider. So if patients are confused by their bills, they are much less likely to pay them. If they're struggling to pay their bills, they're going to be, again, less satisfied. And so by listening to your data, improving the experience, you can raise your reputation as well as your patient's satisfaction. Patients will appreciate knowing that they can trust you to help them along the whole route of their financial journey. Now let's talk a little bit about the healthcare financing process. So this is sponsored by Care Credit, and we want to suggest that the benefits of working with them can be substantial, and you don't have to do it by yourself. They can be your partner in this process with solutions that they know work because they've been doing this for more than 30 years. So at each stage of that journey that we've just been talking about, Care Credit has some tools that can help you. So at that first stage of researching options, you've got the opportunity to go to them and get digital marketing tips, best practice suggestions. They can give you content that you can use on your site to explain the financing options, and how to use Care Credit as a competitive differentiator to attract new patients. And that includes that if people are already paying for other aspects of their care using Care Credit, they'll find you online if you also offer it. And that too can be positive and bring in patients that you wouldn't otherwise be seeing. During that initial content stage, this is a place where, again, they can provide you with some templates that help you understand what's going on for patients and what their questions are, and help you look at your financial policies and make sure they're consistent across the board, even as you're making some of these changes to your procedures. And they can provide training and tips to your staff so that they get more comfortable talking about financial options and more comfortable explaining the financing that's available. And last but not least, they've got both member-facing tools to help you, and they've got pre-qualification tools so that you don't promise financing to someone who doesn't qualify. During the appointment stage, more materials are available to help you explain that process. They can again help train people in this stage of the process and the kinds of questions that surface at this point. And for patients, there's a self-guided interactive experience to allow them to learn more about and to apply for Care Credit. And then at the final stage of paying the balance, this is where it all starts coming home to roost. In that there's an easy way for you to accept payments online using Care Credit. There's a free custom pay link. But the biggest benefits to you are that you get paid in 2 days if your patient has used Care Credit for financing their care. And you're not responsible if the patient then is late in payment or defaults on the loan. That's in Care Credit. And so this can also have a positive impact on your relationship with patients because you're not the people who are following up with them about paying that bill. You can keep the provider relationship and your relationship one that's really about health and care. And in that process, it's a win-win for both parties. Better for patients because they can move forward with care on a timely basis, be less concerned about deferring necessary care, and you can improve their satisfaction with the overall experience. And for you, you can get more payments up front and reduce the days in receivables and reduce a lot of the effort and hassle that goes with collecting that increasing amount that comes from the patient financial experience. I think we're ready to move on to questions and see what you've been interested in during the course of this seminar. Laura?
Absolutely. Thank you so much, Jan, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the box you see at your dashboard. We will try to get through as many questions as we have time for. Excellent. So to start us off here, I would love to ask an attendee question, and it will be, do you have any suggestions for how we convince our senior leadership and clinical staff that the financial experience impacts our overall satisfaction rates?
It's a great question, and I know that that can be a difficult conversation to have. But I would suggest, for one thing, that you can incorporate some of the statistics that we presented in this session, and some of you have asked whether the slides will be available, and they will be available for, you'll get a custom link to the slides, I believe within 24 hours after this session is done. But you also can do your own research, do some focus groups with patients to talk specifically about satisfaction with the financial experience and frustration with the financial experience. And you can certainly invite senior leadership to sit in on those, or at least to listen to the outcome. If you've already got patient councils, bring up the financial experience to your patient councils. Find out what those people who have said to you they are invested in your organization, find out what their experience is with the financials and what they'd like to see improve, because they're already great ambassadors for you. So you want to make sure that you're addressing their needs. And then you bring those things into the conversations that you have with senior leadership. You also really can use that evidence from other people that shows that people make that correlation between the financial experience and the care experience. And you can't afford not to do it well.
I see. Thank you so much for the insight there. The next question I have is, on one of your slides, you suggest the training physician to talk about the cost of different options. And that could seem really unlikely to be acceptable by doctors. Do you have any suggestions for getting over that hurdle?
Yeah, I think one of the big ways, honestly, is because doctors honestly are competitive. They don't want to look stupid, and they want to provide genuinely a service for your patient. So helping them understand that many of their patients are making these decisions based on cost, even if they're not having the conversation, can help them see that it's an important component of the conversation that they have about shared decision making. That if they open the dialogue by asking whether there are any concerns about cost, or talking about, I know that cost can be a factor, is this something you'd like to talk about? And then allowing them to hand off the more technical discussion to a financial counselor. I think you can both help them see the importance of it, but also reassure them that they're not going to be asked to be insurance specialists or financial specialists, but simply to be able to be knowledgeable about the impact of finances on the care that they're recommending.
Great, that's really helpful to understand. Thank you so much, Jan. And the next question I have here is, what timing do you suggest for the after financial experience surveys?
I think I talked about that a little bit, but I do think there are a couple of different phases, and you might want to survey different people at different points. So certainly one informative place is after you've sent out the first bill, when you know that they have seen it and you want to know what their reaction is. I would suggest another obviously important step is after they've paid the bill. For some people, you might want to check after a first payment. For others, you might want to check after a final payment, so you mix it up a little bit. I would also suggest that if you're getting calls and you're fielding calls about finances, that many call centers are sending out a quick survey to find out whether they addressed the issue and how well they did. Well, ask that about the financial questions as well, and use it as an opportunity to slip in some questions about how clear you're being. But you really do want to make sure that you're doing it at a variety of times, because you can't assume that the financial experience, and you guys know this better than I do, is all over on one day. It often takes time. I think there's an average of people receiving 3 bills from their providers before they actually consider payment. That gives you a lot of time, sadly, to find out what they're thinking and what would help motivate them to pay earlier.
I see. Thank you for the clarification there as well. We do have several audience questions here, so I'll jump right into the next one. Does your model work better with folks that have good health insurance or a plan with fewer benefits and more out-of-pocket costs?
I actually think it can work well under either circumstances. When we look at that statistic that says that even a $500 unexpected health bill can be a burden for a full 45% of Americans, it says that you don't have to have particularly high deductibles or out-of-pocket costs for this to become a burden for people. Now, I do think that the higher the level of home payments and deductibles, the more of an issue it becomes. Exchange plans, many of them actually have deductibles of up to $14,000 in some areas of the country, and that's a huge burden for any family to bear. And so you really want to be thinking about how you help them. But even in a lot of industries where people are getting coverage as a part of their employer package, they still may be really struggling to stretch to pay their health care bills and to give their families the care and the treatment that they actually need. So I would suggest that even in those settings, it really matters to look at these issues and to start implementing some of these changes.
I see. That's a great point. And following up on that as well, does the model work best with less serious healthcare needs or those that might be more expensive healthcare?
Well, I'm going to say that the bigger the bill, the more likely you are to want to finance it. So there's certainly that. And the more likely that if your patients are struggling to pay, that you're both going to get into a protracted battle about what this does. I don't know if any of you have been following the Washington Post series about hospitals that are taking their patients to court to collect bills, and honestly, it doesn't make those institutions look good, even though they've been trying to point out that it's a result of the institutions struggling to survive as well. So if you've got options that take you out of the loop a little bit, it's going to be better. And if you reduce the surprise element, you help people plan for those changes. And that's actually, I think, hugely important as well.
Great. Thank you so much. That's really helpful to understand, Jan. Our next question is, would you please talk about the success of this approach or how this approach might work with the private patient navigation and advocacy sector?
Yeah, I think that those are people that you really want to make sure you're incorporating into the financial discussions, and that they're aware of the approach that you use. I might even suggest that as you're making some of these improvements, that they're another audience to bring in to your improvement process and to help you understand what they see with their clients and what they'd like to see and be able to do. I'd also suggest that they're an audience that it makes sense to go out and talk to. Send somebody to discuss your institution, and along the way talk about the great things that you're doing with the payment cycle, from how you begin the process all the way to the end. Because those are the kinds of things, they have outsized influence on groups of patients, and to the degree that you build positive relationships with them, and they really understand what you're doing, that can be very impactful for your patients and for your numbers.
That's a great point. Thank you so much. We'll move on to the next question here. Is how can you have a true cost discussion between physicians and patients when the insurance coverage is pending? It might be difficult to give a range.
Yeah, it is a difficult part of the process, and we've kind of taken one process and broken it into two very distinct steps. But if you think about, a dental visit, the last 3 dentists I've had in 3 different areas of the country, once the dentist makes the recommendation, you go to the essentially financial counselor who calculates your insurance cost for that procedure before they make the appointment, and discusses with you how they're going to go about that. I'm guessing that with the increasing tools that insurers are using to build cost estimation tools, and their increasing interest in helping people cover these costs, that they would work with you on being able to give at least a more valid estimate of the cost. For example, you know what your rates are with a particular insurer, but at the point that you are in the scheduling process or the treatment process, they could share where the patient's deductible is. So you can factor that in. It's not perfect, but it can help you build a much more accurate cost model that then allows the patient, and you can caveat it, of course, you need to caveat it, but it can give the patient some reassurance that this actually takes into account what their coverage is and what their personal financial burden will be.
Got it. Thank you so much for the clarifications there. And we have time for one more question. And our last question here is, what's the process if we want to start offering care credit?
Yeah, and I'll give you the efficient answer since I know that we are at the very end of our time. But the most straightforward way to do this is visit carecredit.com/Beckers. And there you can learn more about how it works, the benefits, and you can actually fill out a form to start the conversation with a care credit representative. And I hope you do.
Fantastic. And Jan, in closing, do you have any final thoughts?
I just want to encourage you all. This may feel like a daunting process, but every journey starts with that first step. And this is a place that you can make a meaningful difference, both in your patient lives and in your organization's finances. So I really hope you start the process and implement some of these improvement measures. And please feel free to reach out to me on Twitter or email to ask more questions or to comment on things or tell me how it's going.
Perfect. Thank you so much, Jan. And that's all the time we have for today. I want to thank Jan for her excellent presentation and Care Credit for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.